In this special episode of the ASC podcast with John Goehle, recorded live from the Illinois Ambulatory Surgery Center Association's 2025 meeting in Rosemont, Illinois, we interview some of the speakers and we discuss recent activities for the association and the benefits of membership.
Welcome to the ASC podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServe, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 252 of the ASC podcast with John Goehle for August 21st, 2025, recording from the Illinois Ambulatory Surgery Center Association's 2025 meeting in Rosemont, Illinois, and from our studios in Spencerport, New York. This is Sue Cronkite, co-host of the ASC podcast with John Goehle and operations manager for Ambulatory Healthcare Strategies. We would like to remind our listeners that the ASC regulatory environment is a rapidly evolving landscape, and the material presented in this episode is based on the most current information available as of the date of recording. As such, it is important to recognize that this information may be subject to change, and we advise all ASCs to stay up to date with the latest regulations and guidelines issued by the relevant regulatory bodies. And joining me today is John Goehle, the owner of Ambulatory Healthcare Strategies, and one of the most respected experts in the ambulatory surgery industry. With over 30 years of experience, Mr. Goehle has authored over 10 books on the ASC industry and is a sought-after speaker on regulatory, accreditation, and finance issues.
So, Sue, you were able to join me with this conference. We had just come back from a cruise when we recorded the actual interviews here and attended the conference, and it was a great conference. I've been attending the last couple of years, and for the second year in a row, I've been doing a administrator's workshop on the second day, which was very good. We'll talk about that in a little bit, but it was a great opportunity to get to know a little bit more about what's going on in Illinois and to meet the wonderful centers there. Interesting that the attendance was up and the number of vendors was up this time. They have, I think they said that they had a record attendance this time, and certainly the vendors were very satisfied with the attendees and the attendance. And it was and the neat thing about Illinois, at least now, is that the attendees are in one big room, and the vendors are surrounding that area or off to the side also.
So they're along the edge of the room, so they're kind of always there. They hear the sessions, and they're always available right there for people to talk to.
Right, and if you're a vendor listening, you know it's a great way to kind of impress upon the attendees how important it is to visit their booths, and it makes it so much easier. And of course, in order to get to the food and to the drink and all that, they had to go past the vendors. So I thought that was a very good way of doing things. I know a couple other state associations do the same thing.
Yeah, and the leadership actually thanked the vendors and just reminded everybody that without the vendors, they wouldn't be able to put on these conferences. So I thought it was a really, they really showed their appreciation. Yeah,
and I did think the conference sessions were good. I apologize to our audience that we weren't able to get a lot of interviews. And part of that is because some of the vendors were nationally known vendors or working for a nationally known company. Like there was a representative from Press Gainey there, and and of course lawyers there. Generally, we have a hard time getting a lawyer to talk on the program, and an organization like Press Ganey, you have to go through months of preparation for it, and also get a lot of permissions. We did talk to the speaker, and we talked about the possibility in the future of getting somebody from Press Ganey to do one of our general recording sessions here. So we'll see if that's successful in the future. But it was a very good opportunity to hear quite a number of speakers here. But unfortunately, we don't have a lot of interviews here. So we're going to talk through some of the sessions that we attended. The first one was enhancing the patient experience in ASCs with OAS caps. And as I mentioned, this was done by Deb Whitrock from Press Ganey. A lot of the stuff that she talked about was the same stuff that we've been talking about for a couple of years now on the podcast. But it's always wise to kind of, remind people of a couple of things. First of all, don't forget about the opt-out process, that if indeed you are a very small volume organization, you're probably, there's a good chance that you might be able to opt out of it if the volume of cases is below a certain number, about 240 cases per year. And those would be the Medicare cases. The other thing that I thought out of the whole session that was very important to remind people is that this information will eventually become public information. In other words, you'll be able to go to a website and pull down information specifically about about your surgery center and how it compares to other surgery centers, both in that area and throughout the country there. So something to remember. I think we all want that. We crave that in a way, as to be able to compare ourselves. But it is important to know that this information doesn't just stop at your surgery center, doesn't stop with the government. It does go out to the public. And that's something that we're not used to in the ambulatory surgery industry. So something to remember. I do want to point out, too, that one of the challenges I think some of the smaller volume centers are going to have if they are not able to opt out. In other words, if they do meet the minimum requirements to do the OAS caps, is that there's going to be a minimum of 200 completions per year. So you're going to have to do at least 200 surveys, or your OAS caps vendor is going to have to do at least 200 surveys per year. So I know many organizations have a challenge just getting, even with their own surveys, people to respond to it. And I think that could be problematic, especially since, as we've talked about, this is a tough survey to do, with over 30 questions that you have to go through. Not everybody is going to be very willing to spend the time either on a computer or on the phone or through email to answer these questions. Sue, you also noted a couple things that she pointed about how to prepare your staff for these surveys.
The speaker really went into how you can improve patient satisfaction, not just for the survey, obviously, but just to keep your patients happier. One thing she had said, just make sure you always explain what you're doing. You get so used to always, you're taking blood pressures, you're listening to lungs. Just be sure to tell the patient what you're doing, because they're probably, from their point of view, they're kind of nervous and they don't, they just want to know what's coming next, because they might be afraid. And being empathetic, seeing what's happening from the patient's point of view, and she even went into detail about empathetic statements, like, it sounds like you might be anxious. What can I do to, ease your mind? Or you look like you're a little bit nervous, or you look like you might be in pain, those kinds of things, and just see how you can help. And even if you can't completely fix it, the patient knows you're paying attention and that you're seeing them. And talking about giving like discharge instructions and that kind of thing, using the teach-back method of giving that information. So you give it in small chunks of information if it's more complicated. Then assessing, ask the patient open-ended questions after each little bit of teaching to see if they really understand what you said, asking them to demonstrate or repeat, in their own words what you've told them. And then if it doesn't seem quite right, clarify what the patient didn't fully understand. So, reviewing. So basically, chunk, assess, demonstrate, and review, just to be sure that people really get what you're trying to tell them, because it's all new to them, even though it isn't to us.
Yeah, and so I thought that was a very good part of the presentation, is it's not just about, I think we spent so much over the last couple of years as OAS caps was being implemented, focusing on the process about, how difficult it was going to be to find a vendor, how it's going to cost you money, that we haven't really talked about the positive side of this. In other words, how are we going to get some good positive results back? How do we help the patients to be able to complete this survey in such a way that we can demonstrate the high quality care that we're providing? So next we want to talk about the Illinois regulatory update. And the speaker was Dr. Somi Nagaraj. I've probably kind of completely butchered that name. But anyway, she is a public service administrator in Chicago for the Department of Health for Illinois. And a couple things that she mentioned, a lot of her presentation was really stuff that we talk about quite a bit during the during our podcast here. In other words, what are some common citations? How does the survey process work? But I thought some of the information she imparted about Illinois was very important. First of all, there are 136 ambulatory surgery centers in Illinois, and most of the surveys that the Department of Health does are recertification surveys. In other words, CMS certification surveys when your certification is due for renewal. And these would, of course, be for organizations that are generally not deemed status. About 49% of the organizations in the state are deemed status. So that's a very high penetration of the accrediting organizations doing deemed status surveys in that state. Also, for those that are not aware, every ASC in the state that is certified must also be state licensed, which is very common in states that have licensing requirements. She went on to mention some of the top 10 citations, and we've talked about some of these in the past, but let's just remind our listeners about it. Number one is environment of care issues, and she mentioned specifically safety from fire. And I think what she was referring to quite a bit was those fire drills and also fire safety training. And so that's something I've been noting actually quite a bit during some of the surveys that I've been doing nationally. Very poor fire drills, no documentation of what the actual scenario was, no documentation about how the employees actually perform the fire drill, and no evaluation. And those are things that are actually required, as well as making sure you have a list or have a sign-in sheet of all the people that attended those. And also remember that those fire drills have to be done on a quarterly basis. And I know people don't always find that they're valuable, but I happen to think that it's a very important process that you should be going through just to make sure people are conscious of how to react in a fire. And once you've exercised this, once you've done the drill over and over again, then when the real thing does occur, you act on it very quickly. Next, she talked about infection control and that, and again, this has been scary to me, but I've seen it also. The sanitary environment issue, it keeps popping up as one of the top citations in ambulatory surgery centers. And that could be not, properly cleaning, not properly maintaining the facility, not doing proper cleaning in between cases, et cetera. Also, they mentioned selecting and implementing national infection control guidelines. And that I see also is that when I'm looking at the infection control plan, not seeing the specific guidelines that are being used in the preparation of your quality improvement, your infection control program. Or sometimes what I see is that they're using very generic terms. For example, maybe a multi-specialty center that doesn't do any GI might be stating that they use the SG&A guidelines, which are only for, of course, GI centers. So something to keep an eye on is making sure that you're not only citing the actual guidelines, but also updating those as things change in your organization. And then lastly, in infection control, she pointed out the importance of making sure you have a qualified person running the infection control program. And indeed, one of on the second day of the program, there was a 4-hour session, opposite a session that I did, on infection control training. Now, that training program was not meant to actually get somebody qualified to be an infection control coordinator. It's meant to be the ongoing training. But again, the surveyor is kind of pointing out how important it is to make sure that you really have a qualified person in charge of the program that has been trained specifically on how to develop programs in ambulatory surgery centers. And to have evidence of that education. Now, just want to remind our listeners, of course, we at the ASC podcast do have a program available for you to get that training. And for more information about that, visit ASC-Central.com. She also mentioned that another common citation, which hasn't been an observation I've had, but she noted that discharge orders being signed by the physician were not in some charts, or were not in quite a number of charts that they evaluated. So something to keep an eye out for. And again, remember that the discharge order we're talking about here has to be signed by the physician who performed the procedure. We're not talking about the anesthesiologist actually discharging the patient, but the fact that the procedure, after the procedure is done, the person who performed the procedure, the surgeon or the endoscopist, has made sure that the patient is ready for discharge when they meet that discharge criteria. And then just a couple other areas that you mentioned: administration of drugs, pharmaceutical services, form and content of the record tend to show up in that list. And we've talked about that a number of times before, but I thought that was an interesting session. Now, she ended by a conversation about new regulations in Illinois called Section 205.135, which is cardiac catheter regulations. Now, I didn't pay too much attention, Sue, because, we're not seeing a lot of this yet, but I do think that's something that we're all going to have to get very familiar with, and I think definitely you and I are going to have to do a little bit more research for our listeners here as the cardiology becomes much more popular in ambulatory surgery centers. And I think I speak for all of us that this is an area that we don't really have a lot of experience even as ASCs. And if you're lucky enough to have come from a cardiology program, perhaps at the hospital or in a physician's office, you're going to have one up on many other people in the industry right now. And lastly, they were pointing out that two things. Lastly, that Illinois is using the online system. They call it IQIES, I think, IQIES, which is the system that they use for entering all of the citations and doing the follow-up work on that. And lastly, I was not aware of this since we don't have any centers at Ambulatory Healthcare Strategies in Illinois. All centers in Illinois have to be accredited.
And then Crystal T. Taylor spoke about preventing burnout. She's the owner and CEO of Fitness is Not a Game. I believe she's a personal trainer, but also does these kind of motivational speeches. And she just talked about taking care of yourself in these really stressful times. So avoiding too many choices. I wish I had taken down the number of choices she said we make in a day, but It was unbelievable because, you wake up and are you going to hit your snooze button or are you not going to hit your snooze button? What are you going to wear? Are you going to, leave early? Or what are you going to have for breakfast? I mean, just all throughout the day, even things you don't even think about. Your mind is making all these choices. So she recommended kind of automating what you can. Maybe you have the same thing for breakfast every day, or you set out your clothes, or, just simple things like that so that you don't start the day. By the time you get into work, you're already overwhelmed. And, you get home and can't think, what do I even want to make for supper because you're just burned out by that point. And just talked about being preventative. Don't wait until you're really stressed or, burned out. Start the day with a check-in with yourself. Take regular breaks when you can. I know that's not realistic in a lot of jobs, but even if it's just right after work before you go home to your kids or your spouse or whatever, take a few minutes to kind of check in with yourself. She always starts the day with her workout because that brings down her cortisol level. I don't do that, but it's inspiring. I don't even end the day with a workout, but
yeah, you're the one that's hitting that snooze button a lot during the day.
Yes,
but you pretty much have that automated, I will say.
Yes, I will hit it 5 times.
Yeah.
But, I definitely agree with her, and I think it's something I should implement because it's so easy to get overwhelmed and just live your life in that overwhelmed state, which you're not giving your best to anybody then. Knowing yourself, I mean, some people, like for me, I need time alone. If I'm overwhelmed, other people, maybe they need to be around other people, just know what you need and not what everybody else thinks you should do, and the same thing with saying no. I know everybody says, learn to say no. But be mindful of your decisions. If having a lot to do and feeling rewarded by it is something that you thrive on, then go ahead and do that. But if you're finding that you're just saying yes to please other people, then, try to just set those limits when you need to. So I know it's stuff that people have all heard before, but it is important to keep it in mind. And I really did like the speaker. She was easy to listen to and really had a lot of good points.
Yeah, and I think I was recording a couple interviews while you were doing this, so I didn't have an opportunity. But that the title really resonates. I mean, we know that burnout's becoming a major issue, that turnover is a major issue. So certainly people, are finding the I think people come to ambulatory surgery centers perhaps latter part of their career thinking that it's going to be a way to kind of wind down. And it's really the exact opposite, I think, that, in an ambulatory surgery center, as we've talked about so often, you're kind of on your own. You don't have the big organization behind you. I always talk about, how, when a code is called in a hospital, you have a code team. In the surgery center, you're you're responding. You're hitting the code button and you're getting some assistance, but you're still the one that takes the lead on this, and that's something that we often forget about. Sue, something just resonated with me as we were talking. You're talking about knowing yourself. Do you need time alone? Do you need time to socialize? I think that's important for you to recognize in your employees. You tend to be more introverted, whereas I tend to be extroverted. But both of us, seek differences. I mean, sometimes it's overwhelming to me, and I just need a little bit of time alone because because I've been doing so much of that. And even though you are perhaps introverted, you enjoy that socialization that comes from other people. Just don't do too much of it. And all people fall into those categories, I think. And we need to know our employees better.
And I had once heard sort of a definition of that, because I always felt like, well, I'm not really shy. I'm just introverted. Yeah. And there is that difference. And it's just really more how you get your energy. And some people kind of get their energy from other people. Some people get their energy from being alone. But it doesn't mean that you don't like doing both. It's just how you kind of recharge yourself. And it might be different on every different day for different people. So.
Yeah,
and know what you need, and don't be afraid to take it.
Yeah, and that's such an important part. Is nobody is completely one way or the other, or the average person certainly is not one way or the other. And then toward the end of the first day, I moderated a session called Hot Topics for Administrators, and I had three wonderful administrators with me. They were all board members with the Illinois State Association. Lauren Blanchard, she's from Valley Ambulatory Surgery Center. Laurie Callahan from Ortho Illinois Surgery Center, and Melissa Rice from Loyola Ambulatory Surgery Center at Oak Brook. And we had a lot of fun. It was a 1-hour session. The danger, Sue, always is when you do things at the end of the day, you're not quite sure what you're going to get response. And we asked some general questions, what are the biggest issues that your organization is facing recently, and what types of challenges are you working on? And without a doubt, everybody really kind of talked about anesthesia being the major issue that they're all facing. And I think we spent the majority of our time talking about anesthesia challenges and what each of the administrators are doing. But the other thing that was interesting, I think, for you and me to listen to is the challenges that the ambulatory surgery centers in Illinois were having with the Blue Cross plan. And I won't go into that here. It's really not an appropriate forum. But recognize if you're having some challenges with the Blue Cross plan, certainly you're not alone in the state. And the State Association has been working on it. And there's many people that are working together in the State Association that might be able to help you. And that brings me to an important point here. I was extremely impressed in talking to the board members and in talking to other attendees there who have really raved about the involvement of the governing body, the involvement of the board of directors in other surgery centers. In other words, helping to answer questions. I saw a lot of it while I was there. People were telling me anecdotally about being able to call up members of the board. So this organization truly, it's fortunate. It's a relatively small, 136 surgery centers in the state, about half of whom I believe are members. So that gives you the ability to really kind of get to know a lot of people in the organization. Yeah. And another point that you and I are constantly making too, how important it is to get out of your surgery center, get to these conferences. Listen, we're big proponents of virtual conferences because we do a lot of them, but there's nothing like, getting there in person. I know, Sue, this was the first one you've been to for a while. You've been quite busy, with other activities, and you haven't been able to attend many of these state associations with me. I think you only went to 2 all of last year. But I think you can't beat that experience that you're going to get. And I really enjoyed that part of it, is getting to talk to people during the conference there. And Sue, I think you and I both personally just want to reach out and thank Andre Bragamoff, who has been a long-time listener of our organization. He's the one that really kind of helped get us back into Illinois. And he's one of the regular attendees at our drop-in sessions, our weekly drop-in sessions for our patron members.
I always enjoy seeing him.
Yes, absolutely. Nice. He's very tall. I was saying to somebody, I think he's actually grown a few inches since the last time I saw him, which I don't think is possible. And you're going to hear him talking when we interview the members of the board of directors. I did want to, before we do the interviews, though, I did want to say that on the second day, there were 2 different tracks. Both of them were 4-hour sessions. The first one was the administrator's workshop, which I presented, where for 4 hours we talked about the responsibilities of the administrator in a surgery center. And I really enjoy doing this, especially since I've done it a couple times in Illinois, just that opportunity to talk back and forth. There was a lot of slides, more slides than I had time to go through, quite realistically. And we had a great talk. We shared information. We talked about different strategies, and it was really a very successful session, if I did run a little bit over. And then in the other room, while I was doing the administrator's workshop, there was an infection prevention and control seminar. And there were two speakers, one from Steris and then Laurie Roderiques, who is one of the people that we interviewed for this conference, and you'll hear her in a few minutes. But the purpose of that track was to work with infection control coordinators to help give them the information they need in order to demonstrate their knowledge of infection prevention oversight. Not only to demonstrate it to a surveyor, but obviously to carry out that function in a surgery center. And according to Laurie, it was a very successful program, a lot of good questions. The attendance was huge. I was a little bit jealous, Sue, because there was
control.
Right. There were 4 times as many people over there as in my session. But then again, I think these sessions are so important, and many state associations are starting to step up and do this as part of their annual conferences.
Yeah.
And so let's take a short break. And during the break, I did have an opportunity to do 2 quick interviews with 2 of our sponsors, RFX Solutions and my friend Paul Doppelhoff, and with Alex Yampolsky with MedServ. And I thought this was just interesting. They weren't really doing a sales pitch as much as talking about the trends with their particular products and products like theirs in the industry. So let's take a short break. We'll listen to that. And then when we come back from the break, we're going to do the interviews. So I'm here at the 2025 Illinois State Association meeting in Rosemont. I'm here with my dear friend Paul with RFX. Paul and I go way back. We've been friends for quite a number of years, and again, appreciate RFX as one of our sponsors here. And Paul, I thought we would talk a little bit about how technology is evolving in such a way that it really has become an important tool for us to improve our efficiency in our surgery centers. So can you talk a little bit about, well, first of all, introduce yourself and your company, and then let's talk a little bit about how technology is evolving and what tools are out there now to be able to help the average surgery center.
Absolutely, John. Great to see you again. Love to see you in my home state of Illinois. So
yeah, you don't even have to stay in the hotel.
Yeah, it's a home game for me. I get to sleep in my own bed for once. But yeah, you hit the nail on the head. Technology really is evolving in the ASC space. Where 10 years ago, I think only maybe 10% of ASCs were on EMR and things like that. That number has continued to grow over the years, and now they're starting to realize that even more of their processes are still reliant on paper. And when you're reliant on paper, that leads to a lot of oversight and a lot of mistakes that can be made that can put you, your facility, and your patients at risk. So that's what we at RFX and other companies that are out there are really designed to do is help you at your centers.
So what are some of those tools that I'm doing a session later on today for administrators where we're talking about the top challenges for administrators. And I don't know how that conversation is going to go, but I bet that paperwork is going to show up. What can technology do to kind of change what we as administrators have had to do for the last 40, 50 years?
Well, I can speak to you specifically about RFX as we're designed to reduce the burden of healthcare compliance, right? Yeah. So with all of the things that we can help with and help them manage, when we oftentimes walk into surgery centers, we find that they manage those things in 7, 8 different ways. They may have a paper binder, a physical binder, or lots of physical binders. They may have one software platform here or another one there. They may have Excel spreadsheets. They're sending Outlook reminders as to when their physicians are coming up for re-credentialing. That's not an efficient way or safe way for that matter to manage your surgery center. So tools like RFX and other technology companies out there help you utilize that to manage your center in a more efficient way. And typically along the way, not only is it promoting that culture of safety, but oftentimes it's saving you time and money as well.
As a surveyor, of course, I always joke, it's always about me. But
it's always about
me.
That's why you host a podcast.
That's right. And put my name on it. I think one of the frustrations I have in so many surgery centers I go out to is that I'll sit down, I'll give a list of all the stuff I need.
and, I'll get a trickle of information, or I'll get the wrong information. I'll have to ask for more information. And, I've been working with some of these platforms now, and just to have, and I know your product does the same thing, they'll give me a login for the 2 days that I'm there on site, and I can just go in and see everything. Of course, it's important that you use the tool, but it's also important you actually are transparent about, the results of that tool.
Absolutely. Credentialing, for example, in so many surgery centers that I walk into, credentialing files are the thing that when the surveyor picks them up, the administrator clenches their teeth and says, I hope this is the right one. Don't look too deep. But tools like RFX give you an efficient way to manage that. We've had surveyors give feedback on RFX and say, we've looked through 3 files and everything looks good and looks in the right place and looks as it should be. But more importantly than that, I see the way that you're managing it. And that not only are these 3 credentialing files that we looked at look great, but I see that you have a plan for these ones that are coming up for re-credentialing soon. Yeah. And it's as much the plan that you have in place to ensure that you have that culture of your safety, safety at your facility, as it is, making sure everything is clean itself.
That is so true. I think you actually bring up a very important point, is that when you're using a paper system, that piece of paper is not going to jump up and tell you, hey, by the way, this doctor's medical license is expiring. Technology. Now, there's been tools out there, to be able to keep track of it, but often, one tool might be in an Excel spreadsheet that you created. You might be using your calendar. Maybe you set it up in SIS, for example, if, in the older modules there. But to have one place where you go to is really a big benefit.
Or even having technology that works for you. Things like with RFX and credentialing, we're automatically going out there and doing continuous monitoring of the OIG, the NPDB, and ensuring that those things are done for you. So it's technology that works for you, instead of you having to do the work even within the technology or manually to go and make sure that you're going to be efficient.
And safe. I think one concern that everybody has right now is our budgets are tight. Mm-hmm. There's it's hard to find employees now, even administrative employees. And it's a lot more expensive than it was before. Now, I'm not saying that technology is going to eliminate or get rid, significantly reduce your staffing, but it's certainly going to make those people much more efficient who are doing those functions.
Yep, you hit the nail on the head. It's definitely we have administrators tell us that RFX is something that can save them 4 to 6 hours a week, just from an oversight perspective. So if you're working with less, you can certainly repurpose somebody and have them work within the technology to make your facility more efficient. And even if there's I know that they have small margins, but even if there's a price tag on technology, it can work in their favor when you look at the total overall cost that you're spending.
And as an administrative director of nursing, you have all that information in front of you. So when it's coming time for a survey, you can double check to make sure all that work has been done by all of your employees.
100%.
As always, Paul, it's great. Make sure that next conference that you're at, if you're a listener, make sure you stop by the RFX booth and see what they're doing. Or I'll provide a link and they can set up a free a demonstration.
Yeah, come find our website or come find me at the next show. I'd love the opportunity to work with you.
Thanks so much, Paul.
Thanks, John.
So I'm here at the 2025 Illinois State Association meeting in Rosemont, Illinois, here with my good friend, Alex, with MedServ, one of our sponsors. Alex, why don't you introduce yourself and talk a little bit about your company?
Thanks, John. Thanks for having me on. My name is Alex Yampolsky. I'm a pharmacist here at MedServ and the CEO of the company. And MedServ, we make digital narcotic management for point-of-care environments and specifically for surgery centers. So we make medication management automation to help make center operations more efficient, safer, and more secure.
And interestingly, your product was one of our first sponsors back in, I think it was 2019, 2017.
A long time ago, yes.
It was a long time ago. So we've been very familiar with your product. And of course, I went through difficult times during the pandemic as it was, trying to get to conferences. It was a difficult thing. So, but you've come a long way since then with your product.
And we're really feeling it. That's now we go to trade shows and conferences. A lot of people are very interested. We get a lot of buzz, get a lot of interest. People are looking for opportunities to use technology that's affordable, that's built for their workflows, and make their operations more efficient.
Yeah, and I think that's as I was telling you before we even started talking, that one of the themes that we are picking up on right now is the need to make ourselves more efficient and more compliant using technology. And there's a lot of tools out there. Pharmacy is one of many, obviously. One of our other sponsors are all technology companies, interestingly. And if I think about your company, you are a technology company also, because one of the big advantages of your product is that there's an electronic component that takes away that paperwork. Can you talk a little bit about how difficult it is to maintain paper records in today's world?
Well, I think because most of your listeners are ASC directors of nursing, operators, or employees, I think everybody understands the paper burden, the burden of the messy handwritten narcotic logs, the binders, trying to resolve discrepancies or research discrepancies as they are discovered. In the digital world, it's a click of a button.
Yeah.
Click of a button, in 3 seconds, your logs pull up, and it's easy for you to figure out where things went wrong. You get notified immediately when the counts aren't correct. It just takes a lot of extra effort out of the equation so you can focus on patient care and on revenue-driving activities.
And it really helps with the compliance, too. I mean, I think as a surveyor, when I go out there, I find not often, but I find, you observe people that are not filling out those forms, like a nurse signs, the documentation before the chart was done or before the count was done or things like that.
Yeah.
And you can't do that with this system.
No, of course not. Yeah. And this makes me smile because I remember one of our first conversations where you were telling me how you went into a center where they pre-signed all their logs, which is just crazy. And, through a pharmacist lens, I often look at waste and how waste is being handled.
Right.
And man, how many times do we see that waste signatures, the witnessing signatures, are done way after the fact?
Right.
Nobody's actually watching it in those situations. And from a drug diversion prevention, that's a huge area of risk. But also from a compliance perspective, it's $19,000 fines for record-keeping violation from the DEA. Forget all the other things that can happen. And I focus on the human element a lot and the pain that can come out of drug diversion incidents, but just documentation and compliance. And that's the world you live and breathe in.
Right.
It's missing signatures, missing data, incomplete, messy, whiteout, crossouts, like all of that is just terrible.
I think one of the things I've become passionate about lately is, one of your requirements is that you appoint a doctor that's going to be in charge of your pharmaceutical services. In a surgery center, unless you're really huge, it's not going to be a pharmacist because you're not going to have a full-time pharmacist. So it has to be a licensed provider, and the most likely person to be heading up your pharmaceutical service is going to be the doctor. But how often do they really go and check to make sure the documentation is right? And how often do they know that the documentation is right?
And how often do they understand the level of risk that they carry?
That's a good point.
Because, imagine if you're the physician whose center gets in trouble with a DA. Imagine if your license gets suspended or revoked. What happens?
Yeah.
Who can order drugs? Can you write prescriptions in your practice?
Right.
You can't. And I think a lot of people don't quite understand the severity of it, nor are they as involved as they really should be in those situations. And that's where technology like ours is a great reassurance of that.
And Alex, I know you're passionate about diversion. It's a big issue now, but people don't think it could happen in their center. What do you think of that?
Oh, it's never going to happen here.
Yeah.
We've had the same staff for a long time. We trust everybody.
That's right.
And unfortunately, 95% of drug diversion goes undetected. And research shows that 1 in 7 healthcare providers admits to taking medications, controlled medications that were meant for a patient. And the other thing that I've been talking more and more about lately is that we're seeing a shift of bad actors shifting from a hospital setting where it has become very difficult to divert, even though it still happens all the time, into much easier settings that happen to have better schedules. And we're seeing a lot of bad actors enter the surgery center market, divert a little bit here, move on to the next job, get close to being in trouble, move on to the next job, and they stay under the radar for a very long time because so many facilities don't have the right processes and systems in place and don't have the bandwidth to really provide the oversight that it needs.
Alex, I'll provide a link. Well, there's always a link in our podcast notes to your site, but I'll provide a link there. But how do they get in touch with you?
They can email me personally at alex@medservrx.com. But otherwise, visit our website, medservrx.com. There's a lot of great content there. We're very active on LinkedIn. Look us up and get in touch. We'll be happy to take a look at your center, understand your workflow, and see if we can help.
Thanks so much, Alex.
Thanks, John.
It's been a long day, and the surveyors just left, and you are exhausted. And looking at the list of items that you have to address, you wonder, how can I deal with this and still take care of my patients? More importantly, you wonder, how can I ever keep up with all of the regulations, standards, and accreditation requirements? How can I always be prepared for a survey and reduce my stress levels? Well, that's what Ambulatory Healthcare Strategies does, day in, day out. We become your outsourced regulatory and accreditation resource. We can maintain your policy manual, develop your education programs, help out with fire and disaster drills, do your risk assessments, oversee your quality improvement activities, help run your quality improvement meetings and governing body meetings, and we can even prepare your monthly or quarterly financial statements and help you figure out where you are financially. We are a retainer-based service. We don't take ownership. We don't charge based on your revenue. We have one fixed monthly fee, and we can tailor your services to your exact needs. So whether you're looking for help getting over a survey, preparing for a survey, or looking for a long-term relationship to assist you with your ongoing regulatory and/or financial needs, please give us a call at 585-594-1167 or email us at info@ahstrategies.com. That is info@ah-strategies.com, or visit our website at ah-strategies.com. Our first interview was with Laurie Roderiques, and Laurie talked about the infection control worksheet and the infection control risk assessment.
And of course, Laurie is our Director of Clinical Services and our infection control consultant, and she does a lot of conferences for us through the podcast. So,
including Infection Control 101, which is training for becoming an infection control coordinator, and Infection Control 201, which is follow-up training on that. So if you want more information about that, visit ASC-Central.com. Let's listen to the interview.
So I'm here at the 2025 Illinois State Association meeting in Rosemont, Illinois, and I'm here with my dear friend and colleague, Laurie Roderiques. Laurie is one of the nation's leading experts in infection control. She's wincing as I'm saying this, but she has been a great addition to our firm for a very long time, and she's here speaking tomorrow on, you're doing 2 sessions tomorrow on infection control. Can you talk a little bit about what you're going to be talking about?
Sure. Thank you, John, for inviting me. The first session will be on the CMS Surveyor Infection Control Worksheet, that if you have a CMS survey, that's the document that they would be using as part of their survey when it comes to infection control. The second topic is on the infection control risk assessment and performing that. I'm pretty sure that's what I'm talking about.
you and I do an awful lot of speeches.
Oh my gosh, I'm so sorry. But
just make sure you look at your notes before you do the presentation.
Yeah, I guess I have homework, but I'm pretty sure that's what I'm talking about is performing an infection control risk assessment.
So, of course, you're bringing up an important topic here. Important point is that a major part of a CMS or a deemed status survey, or a state survey for that matter, is going to be looking at those 2 documents. I'd say quite a bit of the infection control oversight during a survey is going to involve those tools. And you and I just did a survey recently where they were not actually aware of the infection control worksheet, which I think is kind of surprising. So, can you talk a little bit about how important that document is and how easy it is for you to be prepared for that part of the survey?
Sure. I mean, you can download it online, and even I can do that, which is amazing because I'm not very good with
computers,
or anything.
And I should point out, we'll put in our show notes a link to that worksheet so that you can see directly
perfect
how to download it.
Yeah, I think it's Exhibit 351.
It is, yeah.
And you download that, you print it. It's about 17 pages.
Right.
I think the first 4 to 7 pages are just questions about your center. And
background information largely,
Pretty much, yeah. And so that's something that either the infection preventionist will know or the administrator would definitely have that information as well. And then the rest of it is pretty much questions about what the surveyor observes. So you have to know that as your surveyor is going through your center, they're going to be looking at certain aspects, hand hygiene, medication safety. They're going to look at your sterilization or high-level disinfection practices. So it's all there in black and white, and it's yes or no questions. And usually if there's a no, there's consequences.
Well, and there's links information there in the worksheet itself as to what the citation would be, for example, if you're not meeting that particular requirement. So, you and I have often talked about how surveys are an open book test. You should know before you go into it what the questions are that all the surveyors are going to look at it. And especially if you're an accreditation, if your accreditation organization is doing a deemed status survey, you have the accreditation manual would lead you through every single question, pretty much the way the surveyors will ask it.
Yeah, and I'll tell you, I think that that's a tool that you want to use whether you're going through deemed status or not.
That's a good point.
Because the state can walk in at any point that provides you with your Medicare survey or your accreditation organization. So it's meant to be used. It should have. You should run out of the ink on it because you use it so often. I always suggest that, the infection preventionist in a center makes copies and hands it out to different people in the organization. Let your sterile processing department see what the expectations are going to be when the surveyor walks in. Pre or post-op is going to, when it comes to hand hygiene, the glucometer is spelled out on there, or any kind of device that you use on multiple patients, and the cleaning process that goes along with that. So this way, they're not afraid when the surveyor walks in because they're going to be prepared, which they should be anyway, but we all get tense when the principal comes. That's just the nature of the world. And this way, if it becomes second nature and they're used to it, it shouldn't be as overwhelming to them.
And if you fill it out beforehand and have a copy of it with you during the interview that you'll have with the surveyor, you're going to be 2 steps ahead of the surveyor.
Oh, yeah. No.
And then be able to if they appoint, often during that, they don't usually do it at the very beginning. They do it kind of after they've already observed some of the practices. So you can have a conversation at that point as to what they observed and what you normally do to resolve any issues.
Yeah, exactly. It doesn't mean that the surveyor is going to walk around with a clipboard with 17 pages on it.
Yeah.
Because oftentimes, myself as a surveyor, or if I am just doing, surveillance at a center or just observing, I will be jotting down either notes on a piece of paper, or if I have a brain power at the time, remember. But if I see it, all I have to do is see it once.
Yeah.
And that's where that issue comes in. It could be 1 out of 15 people observed did not perform hand hygiene. Then the answer is no. Yeah,
that's a very good point to be made about accreditations, about surveys in general, actually, is that, there are points at which, the severity of the citation is going to be based upon the frequency.
Right.
But you're still going to get cited even if they see one incident where any of these things are not being done.
Correct.
For example, even credentialing, you have 1 file out of 15 that are not compliant, you're still going to get cited for it.
Right, exactly. And so, as I will often say, and maybe those of you that have heard me before know, you can't take the human out of the equation.
Yeah.
We're going to make mistakes. That's what we are. So you can't come down on your staff unless it's all of your staff that aren't doing it. And if all of your staff aren't doing it, then it's a bigger problem within the organization. Obviously, someone either is not teaching them or doesn't know that they're not teaching them.
Or they're not giving them the resources they need in order to stay compliant. I think that's why this session that you're doing tomorrow, I think it's a 4-hour session for infection control coordinators to kind of keep them up to speed. So it's important that you get specialized training to be an infection control coordinator, but that doesn't end with that training. You got to demonstrate ongoing training, usually a good 4 hours a year.
Yeah. So, this is like here at this association meeting, this is one way. If your IP person can go to the conference, they can get some higher level of training, or sometimes you just have to hear it again.
Right.
You might have already gone through it, but then you get little bits and pieces. Every time you hear something, it may, spark something else in your mind, which is the way it should be. You should always walk away with another bit of information that helps you. Mm-hmm.
So you've done a lot of surveys over your years, and what would you say is one of the most prevalent problems that you find when you're going through the infection control worksheet with an organization?
Well, I mean, hand hygiene will always fall out because I think, especially since COVID, we tend to overuse gloves and forget about the hand hygiene aspects that come with before we put them on and after we take them off. Or sometimes people aren't taking them off to go from one task to another, and a surveyor is going to hone in on that. So it's really important. I tell people you don't have to put on a pair of gloves to touch somebody.
Yeah, I think, isn't it odd? I've seen that, especially on surveys. All of a sudden, I'm seeing them wearing a lot more gloves. And you know that they're not doing it most of the time anyway. For some reason, they feel like they have to be wearing gloves during the survey.
It's possible, but I also think sometimes that's just how they practice.
Yeah, good point. Yeah.
And so, if that's not how you practice and you think you have to when a surveyor comes, don't do it because you're going to do it wrong.
Right, that's a very good point.
So if you do it the same way every time, you're less apt to mess up, so to say. Then there's always, the other day I was at a center and they do pain management. Pain management is a very busy specialty. And for a lot of their cases, they were just using a single instrument like a Coker or a Kelly just to point to the skin when they're taking their x-rays. Well, they still have to process that. Yeah. And, OSHA regulation is that you remove it from the room in that container, that closed container. Well, they were collecting them throughout the day in the room, which you really can't do because you're constantly, And then they decided, okay, so they just would put it in a red bag and carry it to sterile processing, and it's like you can't do that either. So it's just making sure that they understand how things are. And I still will see centers where they're not doing point of use cleaning, and how I know that is they don't even have a basin of saline or water. You'd rather water, not saline, but nothing that's moist to wipe off your instruments on the back table. So, it's just things like that. I don't get into the minutia often about, are you following all the IFUs? But if I know where there's certain IFUs that should be followed, then you have to follow them. So, make sure your staff or the staff in your processing area have the IFUs for what they're using or what they're doing. Take a look around your center. Look for rust.
Yeah.
There's a lot out there that we don't see after a while because we don't see the stains in our rugs. Actually, I covered one up at home the other day, so it's not there anymore because it's covered. But someone's going to see it.
That's right. Especially if you're looking at it with fresh eyes.
Exactly. So it's just stuff like that, and just quiz your staff, and it's okay. It's okay. Tell them it's all right to have the wrong answer as long as you know where to get the right answer.
That's a very good point. Is that don't let your staff think that they have to know everything, especially if they're going to answer incorrectly if they're trying to do it off the cuff. Let's pivot to the infection control risk assessment for a bit, because that's one of those areas that I find when I'm doing a survey, when I don't have the luxury of having you on the survey and I have to do the infection control section, it seems to be one of the major issues I find with many centers. They might do it, but they do it because there's a spreadsheet they can fill out, but they don't actually use it. Can you talk a little bit about the importance of it and why we look at it as a surveyor?
Yeah, well, you know what? One thing I tell people is that there's no right or wrong on that sheet.
Good point. Yep.
The only part that's wrong is if you don't take the information and use it. So part of the purpose of that document is to show you areas where you can, where you have weaknesses or need to improve, and then that becomes an issue that you then bring to your quality board or your QAPI committee, whatever. But it just because you have a high number. I'm picking on hand hygiene again, that needs to be worked on. That's okay, because you identified it, and now you're going to come up with ideas or solutions to get that number lower.
Right.
And I don't like to see year to year to year that the numbers have never, ever changed.
Because that tells you that they're not actually doing anything about it.
They're just changing the date on the top of the page.
Right.
So that's...
Sometimes they don't even change the date on the...
That's quite possible, yeah.
But no, that's a very good point. I find that, by the way, with the hazard vulnerability analysis, both of those documents, they should be very different every year as you develop an action plan to take care of whatever you identified as a weakness in your current plan.
Right. And if something happens in your center, it's okay to redo that form.
Yeah. Good point.
That's the whole thing. If all of a sudden, we've been getting a lot of calls or knowledge that centers are having a lot of trouble this year, in particular with humidity issues.
Yeah.
Well, look at your risk assessment. Redo it, because now you have a problem. So it's okay to change it mid-season. You're going to date it, and then you can show that, okay, all of a sudden we had this uptick and we did this, and it got back into our acceptable range, as in the range of our risk assessment, not necessarily the range of our humidity in the rooms, but that's how it should be. Or if you close for a few days, you should do that risk assessment prior to opening. A lot of us did it during COVID.
Right.
So think of it like that. We had to do a risk assessment to reopen. Well, anytime we have a major infection type situation, we should redo our risk assessment.
Hey, let's talk now to the administrators who oversee, or directors of nursing that oversee infection control coordinators. Can you talk just a little bit as we end about the importance of giving them the resources they need to really carry out their job?
Oh yeah, no, it's really important. I mean, one of the speakers here was from the state of Illinois, who was talking about like the 10 high findings in a survey. And so what happened is that she mentioned that one in the top 10 is the infection prevention is lack of training.
Yeah, I saw that.
So, that will show up. You would expect to see it as a surveyor. You expect to see that training documented somewhere, whether it's in their employee file, or if they have their own little manual that's their IP book, and they keep track of all their training. And she had said that it should be from nationally recognized training. And I didn't have a chance to ask her during the session, but afterwards I asked her, I said, are you saying that they can only go to nationally recognized, things put on by the nationally recognized big
like
names?
And
I said, so today here, that doesn't count? And she said, no, that's not what I meant. But the people in the audience, that's what they heard. Yeah. So it's, the not necessarily the presenter, but the organization that is putting it on, if they're recognized, if it's your state association, if it's AORN, if it's a webinar that's put out by SG&A for those of you that do GI procedures, you need to let your IP attend or have the time to do that. You need to give them the tools they need. They should have the standards for infection control. At a minimum, if you do steam sterilization, you should have the standards for steam sterilization. If you do high-level disinfection, you should have those standards, because they need those references. Because how can they make sure the staff are doing it right if they don't know what the right thing it is that they should be doing? And most IPs, are nurses, as they're supposed to be licensed, but we never went through training in sterile processing. We never really worked usually in the GI processing room for our scopes. So we have to understand, because our staff that are in there should be able to look to you for answers as well. So,
Laurie, as always, it's great having you on the podcast here. We'll make sure
you'll talk to anybody.
Yeah, I'll talk to anybody. But and I look for I'll be doing a session opposite of yours, so I won't be able to hear you speak. But
Thank
I'm
goodness.
sure you're going to be able to give them a lot of great information. And again, thanks so much for being with us.
Thank you very much, and I hope everybody has a great rest of their day.
And lastly, we interviewed the members of the Board of Directors of the Illinois State Association. And they talked about the activities of the association the past year. They talked a little bit about the conference and the conference planning. And then they finished by talking about the benefits of becoming a member of the Illinois State Association. Let's listen.
So I'm here at the 2025 Illinois State Association meeting in Rosemont, Illinois, and I want to introduce the board of directors, some of the members of the board of directors of the Illinois Association.
Melissa Rice from Loyola Ambulatory Surgery Center.
Lauren Blanchard, the administrator at Valley Ambulatory Surgery Center in St. Charles.
Andrei Bragimov, administrator at UChicago Medicine Ingalls Ambulatory Surgery Center.
Laurie Callahan, the ASC Regional Director of Ortho Illinois Surgery Centers.
So this has been a great conference. I was here last year. I think I've been here a couple years in a row anyway, and it's great to see you growing again. You know, I know you've gone through after the pandemic. I mean, everybody really kind of suffered after the pandemic, and it's great to see the membership increasing. And what's the most exciting thing that's happening here, Melissa?
I would say that our vendor and exhibitors, you know, we really are putting forth making sure that we become really close with them and make sure that they see how benefit it is for them and also for our members that they're here with us.
Yeah, and I've spoken to a couple of the vendors are very pleased with the layout this year. So one thing, you know, for our vendor listeners out there that I really love here is the fact that the vendors are in the room where everybody is speaking. So they're hearing everything that's going on, as well as it's just easy access. So you have to go past them in order to get food, and I think that's going to give some more satisfaction. Somebody want to talk a little bit about the program?
Yes, sure. So we have a very exciting program. We've reached out to one of our most popular sessions from last year and also added the support from the new suggestions from the other requests that we did a survey for. And so we're very excited to have the support from Illinois Department of Public Health. They did a regulatory update. As always, the labor law and labor updates are very important. We also had pharmacy consultants and Press Gainey, the Press Gainey support, which is a very hot topic, the OS caps that is out there, and we're all dealing with it right now.
Yeah, I spoke to the person who put on the presentation from Press Gainey. Unfortunately, she couldn't get permission to be part of the special episode here, but we're going to try to interview her a little bit later. A lot of great information, I thought, from her on the topic. And I'll be moderating a session, actually, with quite a number of the people that are with me here this afternoon at 4 o'clock. We're going to talk about administrator issues and how you're dealing with things that are going on. Now, can we talk a little bit about the benefits of membership? You have how many centers? 137 centers in the state, and I'm sure you could always use a few more members, right?
Absolutely.
So do you want to talk a little bit about the benefits of membership?
I think the benefits of membership is actually working together. We network, and from a lot of the things we've learned, even with COVID, being board members and part of this organization is being ahead of stuff even before we heard it from IDPH. We were getting direct report from them, and we were in front of a lot of the hospitals with that change. And that network continues to strengthen, and we collaborate even outside of our meetings. That I'll reach out to Lauren, I'll reach out to Melissa a lot of times, and it's like, hey, we have this issues. And that's the huge benefit, is actually being there and knowing you have support outside your center to either confirm what we've been doing or reiterate, hey, wait a minute, what are you doing here? Best practices. So huge value. I've been a member for a very long time and see myself for many, many years to also continue that.
And what do you think? So now you're also trying to maintain more ongoing contact with your members too, right? What are you going to be doing to try to enhance that?
So we are looking at doing some quarterly sponsored meetings for CEUs, which will, help get our members more involved and allow us to reach more of our members with hot topics and things that are important in the industry, while also getting them the education that they need.
Well, and one thing that you're doing too tomorrow is like 4-hour sessions, right? I'm doing the one on administrator, and then there's a great session on infection control, which would meet the requirements for ongoing training for infection control coordinators.
Yes, on our Friday session, we do offer the option for administrator training, but we also offer infection control training, which is huge for a lot of our centers, because those 4 hours will get their infection preventionists their 4 hours that they need for CMS, and it's one easy place for them to go in order to meet those requirements and get the education that they need for the year.
Well, and I looked at the agenda too. It's not just it's not just meeting the requirements. I mean, it's really valuable information from really very talented speakers that you're going to have there. And then you're also going to be participating in the multi-state conference, I believe, in November with ASC-Central and ASC Podcast.
Yeah, it's another member benefit that they have. Becoming part of IASCA is also being able to be part of that, and also then be able to network with your peers as well. So it's a really great conference that we're very fortunate to be part of.
So how do you become a member?
Go on our website, and there is a membership section where you fill out an application, and we'll get back to you.
And we also, if anyone is interested, we have our contact information on the website. And if people have questions in regards to what additional benefits there are, I mean, I know that I am happy for anyone to reach out to me, and I'm sure my fellow board members are interested in answering any questions that anybody has as to the benefits of this program and what it brings to their organization.
And I will provide a link to the membership section in the podcast notes for this too. And again, I really want to emphasize and just have you finish with this, how important it is to get together in person. I mean, we do a lot of virtual conferences. I enjoy doing those virtual conferences, but there is nothing like sitting down at lunch, as we just did, with your colleagues and talking, making new friends and finding out more, from people that are in the trenches. Any last comments on that?
I would just say being a member and coming to the conferences is an extremely valuable part of the networking aspect, and then knowing that you're not alone and you have support.
That is so true, isn't it?
I mean, it is a very small community, and most of us know each other either from our current locations or from locations in prior. And so it's nice to be able to get together, share contact information, share ideas. I mean, some of the best things that I've implemented at our center is from people that I've learned from being at this conference.
I call it phone a friend.
Absolutely.
And I would invite all the vendors that are interested in exhibiting at our next year conference to contact us. And we are very supportive of the vendors, and we actually included and implemented all the suggestions that they provided to us based on our survey. And as you said, they're very happy now.
So when you come to the conference, you're also going to get the AUs and the credits for that conference time. Another part is, we go to our national committees, we go to some other subcommittees, but which is nice coming to Illinois ASC conferences, it's Illinois regs that we're talking to, Illinois guidelines. No matter if you're a beginner starting off running a surgery center or you're seasoned, there's always a good takeaway and always something to learn and a network to build and grow.
And it was great to have somebody from the Department of Health here, too. That I go to a lot of state associations, and that's not always possible. Thank you so much. I really appreciate your time, and we'll post this episode pretty quickly.
Thank you.
Thank you.
On behalf of all of us here at the ASC Podcast, we do want to thank the association for inviting us to the conference this year and allowing us to do this special episode. And of course, we want to thank the people that we interviewed. This was a great opportunity, Sue, for you and I to get to listen to some great speakers and, of course, to meet many of our listeners out there. And I hope that all of you who attended benefited. And I hope that those that are listening now that didn't have an opportunity to attend will think about attending next year's conference. And I'll put a link to the Illinois State Association website for those of you who are not currently members who wish to become a member of the State Association. And we want to thank you for tuning in to this episode of the ASC Podcast with John Goehle. We hope you found the discussion insightful. If you did, please share it with your colleagues in the ASC community and be sure to subscribe so you never miss an episode. We appreciate your feedback and suggestions for future topics. Reach out at any time at comments@ascpodcast.com.
A special thank you goes out to our incredible team, sound editor Susan Cronkite, executive producer John Goehle, and our committed research team. Sue Cronkite, Jenna Alvarez, Judy D'Ambrosio, Mike D'Ambrosio, Zach Kaloritis, Jim Masters, Amy Cronkite, Laurie Roderiques, Kathy Fody, Donna Macchio, Christina Norman, Katie Pearson, and Stuart Rosenberg. Your hard work makes this podcast possible.
Our theme music is by Media Sushi and Mike Noah, and the ASC Podcast with John Goehle is hosted on Podbean and can be found on all major podcast platforms. Thanks for listening, and we'll see you in the next episode.
This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServe, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations, and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.